The Bleeding Management Forum is an incredible opportunity to finally discuss what it means to manage patient bleeding in our total hip and total knee patients.
We had 10 surgeons that are very well versed. They do a lot of primary and revision hip and knee replacements. I think everybody left this meeting with a much larger appreciation of the need for defining when you use these hemostatic agents, that they are necessary.
The forum was outstanding. I think the data that was presented initially by Michael, looking at just trying to identify patients at risk, was incredible.
There was no universally agreed upon set of principles or set of actions that we would all do in every situation. So it kind of opened the door to say, hey, let's figure this out. Let's see if we can actually clarify some things as regards blood management and total joint arthroplasty.
Hemostatic agents have significant potential to reduce postoperative complications in terms of hematoma, pain, swelling.
Since starting using some of these hemostatic adjuncts, I've noticed a significant reduction in the need for transfusions, particularly when it comes to revision hips.
For me, I look at their hemoglobin A1C as far as there being a diabetic. I look at, if they're on anticoagulants before, we're going to put them on anticoagulants after, so we have to take that into account. So all those are factors for me to use hemostatic agents.
A lot of these agents I use in every patient, and I've noticed a difference. I think we just have to be stewards of medicine and maintain, an appropriate data algorithm to understand, is this truly beneficial to the patient?
The opportunity to find a marginal gain, such as meticulous hemostasis with the use of an adjuvant hemostatic agent, gives us another way to help our patients get better and push forward in their physical therapy.
Getting a better handle on this and having some true protocols that surgeons can use to really impact blood loss and blood-related issues after surgery can really make a huge impact on how patients recover from these surgeries.